Why does pulmonary TB cause a persistent cough? Imagine a tiny battle happening inside your lungs that you can't see. When someone has pulmonary tuberculosis, or TB, it's because a bacteria called Mycobacterium tuberculosis has invaded the lung tissue. This bacteria is very good at surviving inside the body and can cause long-lasting effects. One of the most common symptoms you might notice is a cough that just won't go away. But why does TB cause this persistent cough? Let's explore the science behind it. When the bacteria infects the lungs, your immune system springs into action. It tries to fight off the bacteria by sending immune cells to the infected areas. This response causes inflammation, which is like swelling and irritation in the lung tissue. The immune system also forms small clusters of immune cells called granulomas to contain the bacteria. These granulomas are part of the body's way of trying to isolate the infection and prevent it from spreading further. This ongoing battle damages the lung tissue over time. As the tissue gets damaged and inflamed, the airways become irritated. This irritation triggers the cough reflex, which is your body's way of clearing out irritants or mucus from the lungs. But in TB, the cough doesn't just happen once. It becomes persistent because the infection and inflammation continue as long as bacteria are present. Recent research has uncovered more about why TB causes such a stubborn cough. Scientists found that the bacteria produce a special molecule called sulfolipid-1. This molecule can directly stimulate nerve endings in the airways, which are responsible for triggering the cough reflex. Think of it like the bacteria actively encouraging you to cough, which helps spread the bacteria into the air. When experiments were done with animals infected with TB strains that couldn't produce sulfolipid-1, those animals didn't cough as much, showing that this molecule plays a key role in causing the cough. The reason the cough persists is because the bacteria stay in the lungs, and the immune system keeps fighting the infection. As long as the bacteria are there, inflammation continues, and the airways stay irritated. This is why a person with active TB often has a cough that lasts 4 weeks or even months. When TB treatment begins and reduces the number of bacteria, the inflammation lessens, and the cough usually improves or goes away. It's important to remember that not everyone with pulmonary TB will have a persistent cough. Some people, especially in areas with high TB rates, might not cough much at all. This can delay diagnosis because cough is often the main sign doctors look for. That's why healthcare providers use a combination of symptoms, tests, and imaging to diagnose TB, not just cough alone. Monitoring cough patterns can also help doctors see how well treatment is working. If a cough improves over time, it's a good sign that the bacteria are being cleared. But if the cough continues or worsens, it might mean the treatment needs adjustment. New tools are even being developed to analyze cough sounds as a way to detect TB more easily and objectively. In summary, pulmonary TB causes a persistent cough because the infection leads to ongoing inflammation and tissue damage in the lungs. The bacteria produce molecules that can directly stimulate nerve endings, encouraging coughing to help spread the bacteria. While a cough is a key symptom, its absence doesn't mean someone doesn't have TB, so medical evaluation is always necessary. Proper treatment usually reduces the bacterial load, lessens inflammation, and helps resolve the cough. If you suspect TB or have symptoms, it's essential to see a healthcare professional for accurate diagnosis and appropriate care.